Good afternoon, and welcome to Big Moves, Bold Partnerships, a public sector conversation on scaling for family success. I'm Sarah Haight, Director for 2Gen Practice at Ascend, and I'm excited to welcome you to our latest webinar in the 2Gen Investment Case Series, where we are uplifting solutions from public, private, philanthropic, and community leaders who are supporting families through innovative partnerships. This conversation is about the power of public sector leaders in states, their power to influence budgets, policies, and systems for the better, and how they can embed equity, family voice, and partnership into the factors that change and shape families' lives. This week is a very important week for these conversations, and we're very excited by the folks who are joining us. You'll hear from two extraordinary Ascend Fellows who are making bold moves and forging the partnerships needed to reimagine what's possible for children and families. These fellows, Dr. Nate Chomilo and Teresa Ramos, are reimagining family well-being in Minnesota and Illinois, respectively. And Ascend's founder and executive director, Ann Mosle, will share more on their backgrounds in just a minute. I want to share a few quick housekeeping notes before turning things over to Ann. This webinar is being recorded, and we'll share the recording with our network this week. We invite you also to engage with each other in the chat and to put your questions in the chat as well. We'll have a team monitoring and sharing questions with Ann, Nate, and Teresa during and at the end of the webinar, and we'll aim to get to as many of your questions as possible. As always, if we don't get to questions, we try and answer them via a blog that will go up towards the end of this week, early next week. So with that, I will turn things over to Ann, and thank you so much for joining us.
Hi, everybody. Thanks so much for joining us today for this. Will be, I think, a really important and insightful and really meaningful conversation with two of, in my opinion, some of the most inspiring and courageous and powerful leaders in the public sector, putting really child and family well-being at the center of the public sector, and specifically in state agencies. And before we start our conversation, I think we all really want to take a moment to acknowledge both the senseless and the vicious and the violent politically motivated murders that happened over the weekend. And I want to first, on behalf of Ascend and our community, I really, we can't talk about leadership and not pause when we think about Melissa Hortman, and of course her husband, Mark, and John Huffman, and of course his wife, Yvette. When leaders are stepping up and their lives are threatened and their homes don't feel safe, this is not a normal environment. It is not an acceptable environment. And for our work here at Ascend, where we are grounded in our values of ensuring all thrive, that we put our power and privilege to work for families and for purpose, and to achieve a free, just, and equitable society, we also have to remember that it has to be safe. And so I want to lift up some of the other Ascend Fellows in Minnesota. Our hearts are with the families and communities of Minnesota. Mayor Melvin Carter, Mayor of St. Paul, who has been an extraordinary, steadfast leader. Joe Hobot, leader of the American Indian Opportunity Center. Gloria Perez, head of the Women's Foundation of Minnesota, are just some of the leaders in Minnesota. I am so grateful, and we're so grateful to have Dr. Nathan Chomilo here with us today and being willing to get on a plane to be part of a conversation building on his important work around health and well-being for the families of Minnesota and racial equity. But it wasn't easy to get on a plane. So I want to just thank you, but also just for us each to take a moment and pause. Remember. So Nate, kind of opening with, for you at this moment, these are challenging times, but this sort of redefines what proximate means to the heart and safety and well-being. And I just want to give a moment for you to open with where you are feeling, sitting with us here for these conversations in Washington, and where I know your heart's also back in Minnesota.
Yeah, thank you, Ann. And it's been a really hard time for our community in Minnesota, a really dark weekend. I was sharing before how I was actually in clinic. My clinic is in Brooklyn Center, so not too far from where the initial radius was for the manhunt, and there was a lot of unknowns for quite a while about the person that was out there, who they were aiming for, and that fear was felt across the communities and the families I was seeing, and my own, and so it's something we don't take lightly. The opportunity to be here and talk and think about and dream and build together, and I think I've tried to process it by saying, well, where did this come from? And for me, where I'm at right now, it's clear that there's a level of dehumanization that just is the undercurrent of so much of what's going on right now, where folks can see someone as less than or other because of their political views, because of their gender identity, because of their race, or where they were born, or what language they speak. And I think it's important for us to name that, not only when it impacts us directly, but when we see it impacting others. And so my hope is, and the reason for getting on that plane, and coming here today to continue this important work, is that we are building something for my children, for Teresa's children, for all of our children, that can really tackle that, horrible stigma and the dehumanization that's out there, that can sustain a future that everyone truly is valued.
100%. And this is something, Teresa, we spoke about this when we were just kind of coming together and designing why this conversation, and what does it look like for each state to and whether from governors coming from the public sector space, but for each leader in the state to want to make it the best state and place and community to raise all children, all families, so they can thrive culturally, linguistically, from rural, suburban, urban, and really looking at the plurality as really human potential. We'd love to just anything, Teresa, where you've also kind of, when you think about the state of kind of just entering this conversation, coming in from Illinois, and what you're seeing when you think about what it means to set the table in the conversation for all with equity inclusion.
Yeah, I think, 100 and almost 60 days into this role, I think what it means is a lot of listening, right? I think we know when Governor Pritzker says let's be the best state in the country to raise a family with young children, that young children and their families are different across the state, right? We have rich diversity in Illinois, like other states, that is racially, regionally, as you mentioned, culturally, linguistically. And so as we set tables for building this agency, we are thinking about how we listen and engage, where our team goes and drives out and meets families where they are, and how to push the bounds of what the state is able to do in building a infrastructure that can serve across that rich difference and diversity, and listen, right, even across differences in agreement too. So
yeah, well, I mean, it's one more probe on that, and then we'll go to Nate. But having the opportunity to be the inaugural cabinet leader for the Department of Early Childhood, that's a big, bold move. And you had been inside government, but you also come from really being in community, from coalition building, real grassroots. Talk to me a little bit about when you say being out there talking to folks, but building this agency, thinking about that inside outside.
Yeah, so a couple things, because as I was thinking again about this, and after the great conversation we just had, early this afternoon, I really think about this role as not just as a decision maker, but a decision facilitator, and that really means showing up, right? It means, I'm here for today and tomorrow. I will be then home for a couple hours and be in Bloomington. Last week I was in 3 different places. It means going and meeting a group of 5 or 25 at any region to it means moving away from a one-size-fits-all approach, right? Sometimes we go places and we're like, oh, we're hearing the same, this is a systems issue. We are hearing the same challenges in different parts of the state. And sometimes the needs are just very unique and clear, or the gaps are very clear. And so then how do we do more intentional listening there? We don't have a strong internal infrastructure for that. We have a strong internal policy-making infrastructure most times, but not a listening and responding and then hearing and getting feedback. So we're building that. And then it means not just me, but our CFO just recently, we're a team of 14, right?
Wow.
Merging with, other teams that have 14,000 and 3,000, and we'll be a team of 500 or 600 in 55 weeks. But our CFO, who's been with us for a couple of months now, we've all only been together for a couple of months, was on a call with a provider, and he was like, he got off and was like, I get it now. I get it. And it's just like, yes, it's not just me going out there and, our chief of staff and our transition folks. It is just the whole team really being out and going to meet people where they are and understanding from the operation side of the house to folks who are really thinking about service design.
I really love that. I just wanted to lift up one thing that I've been really trying to help socialize is a lot of our states, Minnesota in particular, gets a lot of kudos for our quantitative data infrastructure. We can look at our data, whether it's claims data or our public health data, but we need a qualitative data
100%.
infrastructure that also is giving information with our communities we serve, getting information back, and really helping inform the policies and decisions, the effectiveness, and so that perfectly captures how we can build that qualitative data infrastructure.
Yeah.
Well, building on that, and so Nate, if we just, you're serving in the formal role of the Minnesota Medicaid Director.
Mm-hmm. Mm-hmm.
You are also an active pediatrician. You are nationally recognized as an expert, quantitative and qualitatively, I might say, but really looking at the positive or negative impacts of high quality early interventions from early childhood and health services to either close gaps, build outcomes specifically through racial disparity. And you've done that for the American Academy of Pediatrics, both statewide and nationally, and also working within the social sector through Reach Out and Read. So you've got this multidisciplinary way that you approach something that is a very big policy lever like Medicaid. So I'm curious, for you to be sharing at this moment where Medicaid is being debated, healthcare is kind of up for grabs, all that you bring as your whole perspective as a leader and a human being and a dad. How are you thinking of, what are you seeing and how are you leading in this moment for Minnesota around the health outcomes improvement, closing disparities, and maybe Medicaid? There's a lot there. Go where you want.
There's a lot there. But I will share, I think it starts with your values, like we've talked about here. And so, like Teresa, I have kind of a small but mighty team, and we've really worked, we're only about 2 years old, to really establish our core values, what we call our team relational agreements. So things like being community and equity centered, thinking authentic, accountable, celebration as a value amidst all of the other challenges that we face. And from there, that's helped to kind of inform how I show up in other leadership spaces in our agency. And so the Department of Human Services just updated our mission and our vision. And our mission is to have Minnesotans be able to live and thrive in community. And our vision is that all Minnesotans will have what they need to thrive in community without disparities, right? And so being able to take that kind of mission and vision and live it out, and then being able to, as Teresa's mentioned, show up and share that, share what levers we have within Medicaid. So Medicaid isn't going to be able to fix all the things that drive our health disparities and all the challenges that children and families face, but we can be really more accountable. And in that process, we have, over the last 3 years, there's 2 reports that I've helped lead, one that's centered U.S.-born Black Minnesotans, one that's centered American Indian communities. And we've got a lot of rich engagement and understanding of what's working and what's not. And while each community definitely kind of lifted up really unique opportunities and strengths, there was also a lot of overlap.
Yep.
Kind of three main things I'd say is, one is just engaging in our systems and how hard it is to kind of enroll in the first place in Medicaid and keep your medical insurance through Medicaid. And so how can we improve our processes? The second is a desire for culturally specific services, right? And so in our conversations with U.S.-born Black Minnesotans, the importance of things like doulas and community health workers from the community, to help navigate our systems. With our American Indian communities, it was traditional healers and traditional healthcare services and having access to that. And that's tied to like how we define, what health and wellness is. And then the third is where I think there's a really great opportunity is there's so much that we have designed that folks just aren't aware of, right? And one real great insightful reflection that I've heard from communities, both communities members have said a version of this is that's part of the structural racism. That folks don't let you know everything that you're have available to you through the programs. And so how can we as state agencies working with our community partners do a better job of just helping folks know that, hey, once you're enrolled, this is what you have access to. You actually have access to doulas. You actually have access to community health workers, to car seats, to playpens, like all these things that should come just standard knowledge, but it's kind of hidden in some of the fine print. And so how do we help that share that with trusted community messengers? I think is the other thing. The state isn't always the best messenger to kind of deliver it. And so how do we work alongside good trusted community messengers?
Wow, great answer. I'm thinking about all of the folks that have joined us that are either on the inside of government at federal, state, or local, or whether philanthropy or in community. Those reports you put out, if anybody hasn't read them yet, they are a must read and they're a great learning and roadmap, and they spark conversation. I'm curious, what were some of the lessons you learned about what to stop doing or start doing when you think about putting the conversation specifically around who is most disproportionately and equitably impacted, but then even looking within agencies, healthcare systems, and then just doing it differently and respectfully?
Yeah, I think, over the course of my career, a lot of the times when I, in medical school and some of my first work with Reach Out and Read, it was always kind of let's identify the problem and kind of lift up the gap and the deficit, right? And I've really learned through sitting with community and hearing all the different great ideas that have been put forth before that haven't been followed up on or haven't been fully supported, funded, implemented, that really trying to lift up where the strength, where there is actual lots of assets that are untapped or undervalued. And so in our, if you look between the two reports, my hope is you see some evolution in both how we're talking about the problems, the impact of structural racism, but we're also lifting up the strengths that exist within communities and how we can kind of tap into that again, and not necessarily having to create a new policy all of a sudden, instead of actually better invest in, better support policies that exist, better invest in organizations to help folks navigate the systems, take away barriers where we can. I think a lot of what we heard is just, do we really need to be going through this re-enrollment process over and over again? And we learned during the pandemic that it's actually not too hard to just take that away and have folks have better access. And so I think really sitting there and listening about what are those, steps or barriers that we can take away, that, everything, and this is not new, folks have said this in a number of different ways, but things weren't always this way. They were designed, and so they can be designed a different way as well. We just have to, come to that understanding and move forward together.
Yeah, 100%. And I think the part where, and I'll use this as a way to kind of kick over to the work that you're doing, Teresa, the part that also is we can also use our public resources and implement our policies differently, whether it's doulas, trusted resources, changing sort of the dynamics of who's the resource, who we're lifting up as sort of the solutions or trusted communities. And that's a disruption. That's a big disruption. And this has been something you were very intentional in when you even moved to within the public sector, what that was going to look like for you. And so, maybe share a couple examples about how you're building the early childhood department based on what you're hearing in the extensive and methodical and consistent community conversations you're having, but you're kind of baking that into your DNA and looking to do that differently. And so
we are baking it into our DNA in part because families' wants from an asset framework and needs are going to change over time. And I got to give props to Ann Whalen, our Chief Transition Design Officer, who's methodical, but also I think pervasive in trying to capture many different ways to hear from families, whether that's someone who wants to come sit with us for 2 hours every week, or they just want to fill out a quick survey and respond as a way to kind of get this continuous feedback. I want to piggyback off something you said and talk then a little bit about one of the partnerships that started as a public-private community partnership in the city of Chicago and then evolve, which is, I love everything you've just said. Of course, I'm a cultural anthropologist by training, but data is important, right? And data helps us get gaps, but the challenge typically is when we stop there and we say, oh, the data shows us their gaps, and we look to some of us to get in a room and say, oh, here's what we're going to do about it, rather than saying, hey, what does the community want? Where are there assets in the community, and how do we design across that? But data is important, and a couple years ago, McCormick Foundation invested in the city of Chicago and Chicago Public Schools and our Department of Support Services to try to figure out how to get an unduplicated count of where kids and families are receiving services, and they build out a data infrastructure. Right now in Illinois today, we cannot tell you exactly which kids are being served in which programs and where. We just don't have good insights, and we have taken that work that the city started and we are bringing it on at the state level and building out a whole infrastructure to understand where children are in care, what kind of services they're getting, where there are gaps. Those gaps will not tell us what to do. It just tells us where we need to do a better job of showing up, listening, going out, saying, hey, we want to know, and we're here to be accountable to delivering because we haven't systematically or by design in the past. That's a lot of what we're doing right now as we kind of build the agency for when more folks and programs actually come over.
Nice. And Nate, so from your work, you've talked about making those, literally making some of the shifts based on the data and research that you've done. What has been your experience that's worked well around building kind of partnerships with community, philanthropy, private sector, or even across other agencies?
Yeah, so I'd start with some of the work that came out of the first report, Building Racial Equity in the Walls, that centered U.S.-born Black Minnesotans, again highlighting the importance of doulas and community health workers. And so there was a community organization that was kind of based out of Ramsey County, the county that St. Paul sits in, the Birth Equity Collective, and they worked with other birth workers to highlight how there's been, Minnesota's had a doula benefit for about 9 years, but our utilization, the number of folks that are using it has been really low.
Interesting.
And we've heard a number of reasons for that. Some of the administrative barriers to, register, the trainings that you have to go through to get on the registry, the payment to be on the registry, and then the payment for the services themselves.
Yep.
And then you have to practice under a licensed provider. And so the Birth Equity Collective worked with others to bring forth with legislators a bill to increase reimbursement rates. Because we had this benefit, but the reimbursement was so low that it wasn't being utilized. I think we were amongst the lowest states who had a Medicaid benefit, and as a result of that, we're now amongst the highest. We're either the top or second for how much a doula can get reimbursed over the course. And the report itself was cited when it went forth in front of the legislature. And then we've since used that same network to help do the training. So now that there's no longer this requirement, the doulas have to enroll directly with us. We provided training because what we've heard and seen is for smaller providers, kind of enrolling and billing in Medicaid can be a very complex thing that is also a barrier. And so how do we then use our resources to help folks navigate that so that our members have access to these services And so I think that's been one example of how we kind of heard something in community, we took it through, we proposed the policy in coordination with our legislators, and then we've, in implementing it, have continued. And so now we're hoping to, that was about a year ago that we've, changed some of that, and we're going to start evaluating it. Are we seeing, increasing utilization? To Teresa's point, can we look at different, areas, different neighborhoods, different, population groups to see who is and who isn't benefiting, and how we can continue to kind of spread the word and continue to tweak and iterate from there.
Well, just one more part of there, because I do think, well-being, if we're not well, what's going on? And I think we're at a part where it just, especially as we're also seeing some of the threats coming down from the federal government, sort of very real threats on Medicaid, has a dramatic impact in every community, in every state. But with this positive piece where I feel like the work you've been doing that is also really centering in U.S.-born Black families and young families and Native American, American Indian, it's getting into the system, the right level of payments. I would assume sometimes when you do the culturally appropriate response and you're building with community, you're going to get better results. I'm sort of wondering if you could wave your magic wand on what it should look like and can look like, where you've got making the resources and the system work for the community culturally based models that's also building out a healthcare sector in the state of the Mayo Clinic, and healthcare is also a big economic force. What are the opportunities to get behind this more? Because literally, if we are not ensuring that those that have been more disproportionately impacted are prioritized, we're not going to get to the ultimate goal.
Yeah, I think to kind of blend a little bit of what Teresa and you're touching on there. I've talked about whenever I'm talking within my team and agency, when I go talk to medical students, residents, grad students in policy and nursing and social work schools, we're more familiar with this quality improvement model, PDSA, Plan, Do, Study, Act. From a policy perspective, it's you take that and you adapt it to say, let's identify the need. Let's look at what data we have available to address it. Let's propose a policy or program, and let's evaluate it. And along every step of the way, we should have community co-creation. And when I say 100%. Communities, I usually lead with, like you're touching on here, the communities that have experienced the most inequity and the most gaps, whether it's due to structural racism or other types of inequities, because it makes a lot of sense. We can improve it for our communities that have experienced the most gaps. It's going to improve it for everyone. Absolutely. And the needs that they identify actually lead to addressing things for everyone. Another example coming out of that first report was, okay, our processes for enrollment aren't great. We know that a majority of our kids who identify as Black in Minnesota are covered by Medicaid. Let's have continuous coverage for kids in those first 6 years of life, right? And so that wasn't just for Black kids, it's for all kids. And that's a policy that was put into place. We got approval from the federal government this fall and is now active for all children. At any point in those first 6 years of life, you're eligible, then you don't have to be redetermined to 6. And so I think we can really find ways to lead from our communities who've experienced the most discrimination. And again, that point that Teresa, you're touching on, data is important, but you don't just stop there. And we need to have community at the table thinking about what the data is, what are the data sources we're looking at, what's the policy and program. Well, how do we define success and failure, which I think is another thing that commonly
and who gets to define success and failure? I'm having a very similar conversation on early intervention. We have a model right now that's based on the current state of EI, but we know where we're missing is in 4 Black communities in Chicago and in some rural communities. And when we think about, okay, well, not just here's the lay of the land, but what do we do? It means really digging deep in those communities, putting staff time and budget time in figuring out where our communities, where should we show up, where have we chronically underserved as a state or with public resources, and then figuring out how communities want to measure success in addition to what the state does over there.
Oh my gosh. And so as you're doing that, and the work that you're doing, Teresa, and I love Governor Pritzker's commitment to make
Me too.
Governor put you on, and all governors, we want to work with you to make the state the best place to have and raise a child and a family. And I'm curious, like one of the big things at Ascend is how we really think about a two-generation approach, and that really thinking about children and the adults in their lives. However, a family defines himself, of course. How have you thought about that when you think about early childhood and the early childhood agency? And
a couple things. One, part of the reason why I'm in early childhood, and I did a lot of work in K-12 with some early childhood and some higher ed, but it came because in K-12 you think about the student, you don't think about the family. In early childhood you think, the student, even in K-12, the student can't be successful if the family is not also successful, but in early childhood folks get it, and I really appreciate how much in Chicago and Illinois the ecosystem really gets that and centers that. I think I was rereading the Big Moves Bold the 2Gen report as I was coming in, and I was thinking a lot about the data infrastructure that we're building. And I think, well, maybe not day one in 55 weeks, but thinking about how our internal data doesn't just look at children and where they are in programs. It really has to be intentional partnership with our Department of Human Services, Department of Healthcare and Family Services, really thinking about where can we get a holistic view of what's happening across families. And then, this might seem basic or extra, and I say this a lot, which is we are starting with centering families. We're asking them what they want and need. Not just what they need. We don't want that scarcity mindset. We want to know what they want. We're asking them directly. We're building our capacity to engage directly, building that muscle, not just going through our partners, which is hard, right? Like they're used to early childhood is not the center right now of any one agency. Our external partners have done a Herculean job of elevating early childhood in Illinois, and now we have to build that muscle internally. And then we ask providers what it's going to take to deliver for families, right? And then the state comes in and say, okay, what can we change in statute? What can we do in our budget? How can our operations, our contracts? And it seems intuitive, but it's not how we operate right now. And then we have to go get permission from everybody and go. It's recentering and re-anchoring everybody in that life cycle of centering, when usually what we center is policy expertise and just pull ideas from other states. Don't get me wrong, I can talk to you about 7 things right now. We'll do that later. But I want to do that, and I also don't want to replicate what isn't working, and I don't want to put something on our communities that was designed for someplace else, right? And so I think it's really just being intentional and saying we're going to be accountable, and we're probably going to make a mistake, and we're going to come back and try to figure it out.
Listening, being ready to respond. Well, one kind of like last question I want to ask you, and we're getting some questions coming in from the chat, but there's, keeping families and community at the center, and what does that mean to scale? Keeping trust, like in relationships, authentically strong, and scaling. Nate, as you're doing this, and I mean, I am not a healthcare expert or health policy expert. I have learned a lot, and I'm really personally terrified about Medicaid, and that's you're at the vice of that storm, and how you're also thinking about care. Like, do you see ways for how we're engaging community and family centered in a way that can help in this debate and discussion around Medicaid?
Yeah, absolutely. So one of the things that came out of some of our work with the Department of Health during the pandemic and the emergency response was working directly with communities to set up different touch points for resources, masks, testing, hotlines, things like that. And we used that same approach when we went through what's called the Medicaid Unwind, where everyone had to sign back up for health insurance through their state, and folks need to kind of be aware that was happening, have assistance navigating that process. And we, through that process, we're able to see, because we held what we started in 2023 called our Medicaid Equity Forums. And we would bring folks together. We'd bring our managed care partners, counties, enrollee navigators, expanded to include our federally qualified health centers and other clinics, some of our folks from community-based organizations, religious organizations, to all let them know this is happening, right? This is happening, and then we're here. We want to know what's working well, what's not, how we can improve it. Through that iterative process, we got a lot of great feedback that helped improve our internal systems, and also we did things like PSAs with our local public television. We showed up to kind of what we call open streets, kind of like open community fairs and events to let folks know and be in community about this. And we saw our disparities in who was getting kicked off of Medicaid decrease and almost actually be eliminated for some communities along the lines of race, ethnicity. And so we've used our equity forum this year. We had it in April to focus on these pending cuts, right? And to say that if you didn't know, this is part of the conversation right now. And we did that with two focuses. One, because we wanted to get the word out and let folks know so they can engage in whatever levers and conversations they have to talk to their legislators, their representatives in Congress. But also because it also is another opportunity to kind of get back to what we were talking about earlier, to say, hey, did you know that Medicaid does all of these things, right? And so like, hey, it's not only important for us to save it, but it's important to make sure that we're using it to its best ability, and let's help shift the narrative around, how we talk about Medicaid, who is on Medicaid, who benefits from it. We've used that to kind of help launch some work that my comms partners are doing around Medicaid Matters in Minnesota, and they've done this Faces of Medicaid campaign where they're having folks do just short testimonials about like what Medicaid means to them or their caregiver. And so I think, when these big changes happen, leaning into our relationships with our community partners to talk about them and make sure, because we all are in these policy spaces, we live and breathe it. Of course it's happening, but honestly, when I've been in another number of community spaces, folks are like, they're really talking about doing that. There's still a level of surprise and disbelief because we're talking about such big numbers that sharing that information, letting folks know what you can do about it, and also how in the meantime you can take benefits, or you can take advantage of the benefits that we have to help you and your community achieve their full health.
This is one where I so appreciate that, and I think for whether intended or unintended consequences, when we think about the narrative story between Medicare and Medicaid, because of some, if we go with good intentions, don't want to stigmatize what is a, public benefit, but it's a public benefit and a public commitment. Because the nature of each state kind of having a slightly different name of sometimes how they refer to their Medicaid program, the kind of conversations at the community level I've had, and what I've seen both through research and just the conversations, many of the folks who it's a lifeline for so many families, and white families are the largest, proportion on that, or number. People don't know that the folks that are even relying on it don't even know that they're on it. And I am just like, if like all 50 governors, or maybe Governor Walz and Governor Pritzker and maybe, Governor Kemp or something, just said, we're going to all call it what it is with pride and importance. What would it look like? Because it's been confusing, and so, but it's also one of the most important ones. And so I'm just curious. I sort of went off on my little piece, but I think that it's so important, and the folks don't know what it is when it serves them.
I mean, one of my things that is really important as we build up the new agency is our communications infrastructure. It is kind of, I would say, not the first thought, right, when you think about service delivery, and yet so many of our challenges are in communication, the why, the what, in a way that translates the policy back to folks about why these things are important, and getting it out there and meeting parents where they are. If they're on, some of our child care resource and referral agencies get the most comments and questions and ask for help in the middle at 2 a.m. via Facebook, right? This is where we need to be if we're going to meet families where we are. We're going to say, here's what the services are, what we can provide. It really is investing in that infrastructure of explaining and communicating and getting those feedback loops or circles, right, to back. So I think it's incredibly important.
And I just want to build off of that, states can't be everywhere.
That's
so one
true.
of the really cool innovative approaches that one of our community-based organizations did is they went into WhatsApp channels, and they were sharing information about re-enrollment on WhatsApp channels. Again, and if anyone who's my family's from West Africa, Cameroon, I'm on the WhatsApp channel. Some of the messages are typed out. Some of them are audio recordings, some of them are videos. Like they know how to communicate with their communities, right?
Yes.
And keep them connected, right? And that's not something we're not going to be able to hire enough people at the state that have all the different types of experiences and knowledges, the privacy issues of getting into some of those places. But if we can give the template of here is the message that we want to send. Now, can you carry that to the community? That can be just as impactful, if not more.
100%. And like how we think about those trusted networks and cultures, both in how we get information out, and I also do think there's ways to also think about different ways to ask for feedback back. Because that's like next level of play, and it's also civic muscle and capacity and leadership. Okay, so Monica Barzak has a great question here that I think is building on where we are about are there examples of successful strategies at the city, community level in Illinois or Minnesota that Nate or Teresa that you'd like to speak to, that you'd want to lift up? And Monica's sort of asking everybody out there about, likelihood of a big move is higher at the city level than at the state. And so I love that question. So big moves that you see at the city or community level in your states. But I'm also curious to take a moment for that. But when we also do those, what are those big moves that might be in Duluth, St. Paul, Brooklyn, or, we can go through, but also how it's done in a way that like we can be community deep or city deep, but then also statewide. So.
Yeah, so the one that comes to mind is actually from before I stepped into the role as Medicaid Medical Director. I was the medical director for Reach Out and Read Minnesota, as you noted. And with our former executive director, Lynn Burke, we had worked with the Southern Minnesota Initiative Foundation. And their goal is just economic thriving for their region. And they identified early on that kind of early literacy is one of the ways that you support families, and it contributes to school readiness and contribute to that economic thriving. And so they planted the seed money for Reach Out and Reach to expand across all of their 20 counties. A clinic was interested, so we had to do the work to go out and say, hey, like this is the benefits and here's how we can support you. And then the clinic signed on, they would then fund their books, I think for the first 2 years.
Nice.
And so that helped us really start to spread in that region. And then when we came time to kind of go in front of the state and make the case to our state for a continued investment, that was a real strong, case to show, hey, we've got this kind of private partnership already. Your state dollars are going to help amplify that and continue. We've learned lessons in that space and continue that throughout, the state. And Reach Out and Read Minnesota's had state funding for since 2019 consistently, and has continued to expand. And so I think, to me, that's like one example of, really starting regionally, being attentive to what are the needs there, that private investment then being something that can help bring the public investment along and continue to advance there. And I think when we're thinking about the big move there, it is planning out maybe a little bit longer right now. Let's start and really kind of, whether it's lifting up something that's got a lot of potential, or something we were talking about earlier, there are a lot of great connections that have been made over the last 5 years in response to the COVID-19 pandemic. And with the federal government backing away from some of their commitments to fund that, where can there be investments to keep those connections going and step into that void?
Ooh, I love that.
So I'll go quick. I think I'm going to go back to this Chicago McCormick Foundation, Chicago Public Schools, and then really we're community partners like Edgar Ramirez and Chicago Commons said, hey, Head Start, how do we get together and actually really understand where children are, where our data says children are, where they're not, where our reach is. And that was the Chicago Early Childhood Integrated Data System that is now going to become a state early childhood eKids integrated data system, and then we'll take on the cost for that for the whole state. And so it's just this cycle of where there's innovation, learning, and then figuring out how to scale it at the state level, because ultimately, state policy is designed to have local impact. It should be designed to have local impact. And then we are just starting with a design firm called Shy by Design. It's an anti-racist, human-centered design firm, really to say, okay, we've identified gaps in where we have our program designed for EI. Let's go deep in these 4 neighborhoods in Chicago and in kind of Peoria, Illinois, to figure out what we can be doing to design the program better, and then we'll have to take on the work of figuring out how to make sure we don't have a one-size-fits-all program statewide that supports EI in these communities. And those are two, at least one area that I'm excited about that's coming up.
Yeah, no. I love both of these, and the one part that Nate said that I wonder. We'll put it over here because we've got a bunch of questions coming in, but where the state government and public sector can actually provide, whether it's funding or conversations that incentivize the connections. I was thinking, Teresa, as you were talking, where the kids are and the 24/7 nature of early childhood and care. And so where the kids are and where the adults are, and the adults are where having to work maybe multiple jobs at times. And also it's not like it's a 9-to-5 world, that's for sure. Was, any kind of big moves you're also seeing with the private sector or employers stepping up that care about early childhood and childcare?
I think we see it in pockets,
Okay.
but I think, part of what we'll need to do over the course of the transition is really think about what the space is for bringing them in more comprehensively. We see them working with child care resource and referral agencies where there is a lot of industry partnership, but there's a way to do it systematically, more so than we do right now.
Yeah.
And I'd just say in Minnesota, the health system I work for, Health Partners in Park Nicollet, for about 6 or 7 years now, maybe a little bit more, has launched what's called Little Moments Count. And it's been a real campaign to bring other healthcare systems who kind of recognize the importance of early brain development and early childhood together with other folks in the childcare settings, in schools. They've partnered with Minnesota Public Radio to kind of do ad campaigns. They've set up community advisory boards from our American Indian community, our U.S.-born Black community, our Black immigrant community, our Hispanic and Asian American communities, all to kind of inform things like Reach Out and Read and how that's implemented across the healthcare systems, for example. Or there's a parent-powered text program that they've helped kind of disseminate. And so I think they've really kind of stepped in to say, hey, there's just practical things that we can do, like Reach Out and Read, parent-powered text, and there's that narrative piece too that's really important. And they've engaged employers around, hey, this is your future workforce, or this is your workers really care about their kids. Are there ways that you can support them so that they can be more productive? Right. And I think there's opportunities there to engage and being led from both the healthcare side, from the educational side, and from the employment side.
Yeah. I love that. Very win-win, which I think is needed now. So we have a big question here around, in addition to the threat to Medicaid, states are facing the elimination of FEMA, education funding, and other major federal funding sources. The compounding effects of these losses exacerbate the crisis across the board. And curious to know what conversations you all are having as part of it in the states, and what you're talking about, what will happen to make best use of the resources that are available, but to adjust to the certainty or uncertainty of not having, in Minnesota, it's 880 million or billion of Medicaid that is at risk. 800.
It depends.
Okay, so I was trying to
anywhere from 500 million to 1.6 billion. Yeah.
Okay, all right. Well, I split the difference.
Yes.
But okay, so we know. Okay, we have conversations here in Washington. It's whiplash. Do we have a Department of Education? Do we not have a Department of Education? Is this being, FEMA being cut? Literally, how are you all preparing or having these discussions in your states?
We have, I think we've been having the conversation since January, since the first time Head Start couldn't get access to their funding. Our early childhood budget in Illinois, combination of state and federal, is about $3 billion. That will be my budget in 55 weeks. That does not include $500 million that's just directly to Head Start. And so, there isn't, and that also doesn't include that the largest amount of federal dollars that go to school districts, of which we have 860, is Medicaid funding. And so, the threat is real, and it is huge. some ways there's not a way to predict what's going to happen.
Yeah.
Even if we're prepared, that preparation there's no way for the state to cover all of those costs in a moment. And so a lot of it is thinking, how can we get creative about, how folks are aligning funding, how in communities, where do we have assets, that might serve children and families differently than what they currently have. There's no one size fits all, but it's kind of a continuous conversation with our partners and new partners in different ways than we've had with Head Start. We don't always talk to folks who just get Head Start funding and aren't also tapping CCAP or some of our state dollars.
Yeah.
And now we're talking to them much more concretely about their budgets, and they're sharing their budgets with their peers to say, how did you make this work and what else are you tapping? So there's a lot of that happening right now.
Yeah, and I'd add that very much similarly, until we kind of actually are faced with it, it's really hard to plan because you could get really far down, really specific, and then a new
Everything
proposal
changes.
comes. But I think some of the things we've been doing, if you go to our, if you Google DHS Minnesota Medicaid Matters, we've been putting out a lot of data on who is impacted right now, and with that, that's going to give us a place to start once we know, if it's going to be eligibility that's cut or certain services that are cut, where to start. My team is trying to look at that data and saying, who's currently impacted by the different eligibility categories that are being talked about, so that we can then kind of contextualize that for the decision makers, which is going to have to be our legislators ultimately that have to kind of make these hard decisions if Congress does make some of these big changes. And they'll ask us, if we propose this, what's going to be that? So we're trying to, at the best we can, have that information available so that you can see, particularly from an equity lens, who is most impacted. That's something that I've always said. Equity work doesn't stop or isn't just when there's plenty. It's also when there's cuts, and so that we can bear witness and track. And then over time, when we have an opportunity to make investments back, we can go back and say who is most impacted by that round of cuts, particularly in states where we have to balance our budgets, and so I think some of our work is like bearing witness and communicating that, so that again our communities can make and incorporate that into the decisions they make for our leaders for years to come.
Just one thing on there, the other brutal truth that I would say, right, as we think about the advocacy that needs to happen right now, and we know like the ROI in early childhood, we've known it for a long time, and that only gets us so far. Right? You have to be in relationship. We need our early childhood folks to be in relationship with their legislators, their state legislators, their federal delegation constantly, and more so than they've ever been, to give us a fighting chance.
You took it exactly where I was excited to go, and there's some last question sort of about trust, but I wanted to pull on this one because where we are now, and Nate, those are powerful words. What does equity mean when we are facing a challenging and resource-reduced set of conditions? To bear witness, but also how we behave. And just when you were talking about like the community of early childhood partners in the legislature, I think this is a moment that we have to think about civic leadership, civic capacity in entirely new ways. And I remember I've been on the board, and I love AP, the American Public Human Services Association, and Reggie Pica, who leads it. One of the ideas I had shared like ages ago is, what does it look like when we talk about what is our basic roles to build in voter registration, civic engagement, leadership, to also even with like the partner organizations. And I'm just curious, in 2026 we'll have 36 gubernatorial elections. It's a time for a conversation where it's not, anyhow, just like, but how do you see opportunities to really think about that civic engagement, both from bearing witness to both advocacy or running for office, or operating in the legislature? How do you think about that?
Yeah, I mean, I think bearing witness, I use that because there's so many kind of decisions that people might not realize impact them in their everyday life, as you know, because of the complexity of our systems.
Yeah.
And so I think it has to be, we need to get to a place where it's not just like every 2 years or every 4 years. It's just a part of our conversations and our engagement and our relationship with communities as public stewards, is to say, here's our programs, here's how they impact you, and provide them with information so they can actually make decisions for them and their families that kind of reflect their values and their commitments. And so, I think certainly in 2026 there'll be opportunities at the state level, at the federal level, but I think our job is to really continue to move. And I think one part too is like, how are we governed? What are the incentives? Right? I really admire the community health center model, for example, because their boards are 50% by the community, and so how can we kind of move state policy making and processes to be more community centered, community governed? We've seen some of the limitations, let's say, of our kind of representative structures. How can our kind of administrative structures be better, informed directly by the people we're serving, our communities, and have that feedback loop that Teresa's talked about present? And I think if we're successful in that, that will naturally then lead to folks being more understanding about the role of voting, of themselves maybe deciding that they want to run and be part of the change.
Yeah. I love that.
And I just layer on, which is, I think, bearing witness, that communication, that just elevating transparently what's happening is one part of what I think we need to be prepared for the moment, to withstand the moment, and then to win moving forward, right? I think that is just, how are we in deep relationship and communication with others? Who are they in deep relationship and communication with? How do we use our relationships for the collective good, the collective advancement? At every conversation I've been to, nearly probably 50 conversations in the last several days of just partners coming together, is, do you know who your legislator is? And are you talking to them? And are you talking to your neighbors? Are you talking to your colleagues? Are you building the kind of relationship infrastructure that's going to help us withstand and advance in the future? I think that is that will help us in any election cycle. It will help us when we face cuts and the state is trying to decide what to do, and being really intentional about that. So.
And then one thing to quick build on that is, as a pediatrician, as a dad, we know about positive reinforcement.
Yeah.
Right?
Yeah.
I think in a time where there's a lot of negativity, if we have these opportunities for folks to be a part of the change, whether it's stopping harm or actually contributing to positive change, that positive improvement, or that positive reinforcement, I should say, builds more engagement, whether it ends up going to the ballot box or running yourself.
Oh my gosh, absolutely. And I think, whether with leaders, families, leadership, of course, lies in all. The simplest lesson, success inspires success. And hope, you can concretely build hope. And folks want to be part of something larger and meaningful. And families sometimes who have the most disproportionately impacted by challenges, historical, structural, or situational, are sometimes the one who actually want to give the most to others. And so I think the kind of closing out on this question, I want to invite you both to maybe share what is what's your next or kind of commitment or big move that you want to take from, we've been in some deep conversations today, so it's been a great day. We'll share more out later. But sort of what's the next bold move that you might not have thought about before that you're going to take back to your work and your role, but also I think really where we started, I care deeply about also the humans that are really trying to do this systematic work, and we have to support our leaders like the two of you, and the leaders that are out there, be they in community or building, kind of the public sector. What is one thing that you think would be helpful to you to keep you going, whether it's we've had a muff up, we've hit a barrier. How can the community also support leaders like yourselves? So your bold move, and how can the community, the Ascend community, also be supporting you and your leadership and your well-being and your success and your ability to keep sticking with it?
Yeah. It's the bold move is so hard because it feels like every day for the last 160 days, and the next 55 days is full of bold moves, right? Full of pushing the envelope of what internal bureaucratic infrastructure can be to serve families, how agile we can be, how big we can build our internal operations to be diffuse. And so I think it's the one thing I'll say is building a budget that I think our first agency budget that really honors what we've heard from the communities, and this first, that folks don't see till next February when the governor announced, but that we'll get prepared now in the next 3 months. So it'll be to do that and to be, I think, in even more conversation with my co-fellows. For me personally, and I think I'm going to attribute this to Ann and Casey, who are here with me, the Chief Design Officer and my Chief of Staff. I think I am leaning into just my extroverted nature. My personal next step, and I started this a month ago, was on top of everything else is like, you know what I need? I need a book club. I need a book, etc. club. I need a book/movie/podcast club, and I'll just host it monthly. And we started with On Tyranny, and I invited literally my neighbors, my friends, former coworkers. I was like, we need to be in community with each other, and I have to live that and have that energy and bring people together. And it was great. And everybody is gonna watch Sinners, and we're gonna get together in a week to talk about that. And that's gonna it doesn't have to be on Tyranny or Sinners, but that's what I'm gonna do to be in deeper relationship with people who are in my life in one way, and build their relationships with each other.
Oh,
so there you go.
Love that. I love that. Last
I
word.
I love it too. Andor would be
okay.
my
I'll add that. You can drive in for the weekend.
Yeah.
I
mean, I think our bold move, is to, not be too derailed, because distraction is a strategy, of folks who want to see progress derailed. And so, like we've talked about before, one of our commitments is to going to communities, sharing the data that we have, and continue to iterate. We were fortunate to be selected as a state, and my team is helping lead our Transforming Maternal Health model to really try to think about how we pay for maternal health care and community care better. And so really trying to be community-centered and led there is kind of like my big move going forward. And I think within it, personally, grace, right? I think, both for myself and for from our community members, I think we're all on different levels and I've reflected in different spaces of my own critical consciousness journey. And when you realize something, how you can do better. I think that folks at state government they're all lots on different places in their own journey. And so, it can be our human nature to, once we hit one bump in the road, it's all back to the state, being the state again, right? And that, while it's understandable, really helpful in this time when folks are showing up consistently. And I think if they're showing up consistently, they care. If they just show up once in a while, maybe you can hold that criticism. But if we're showing up consistently, having that grace to kind of muddle through this messiness together.
Totally agree.
Oh my gosh. Well, thank you everyone for joining us. And I just want to thank you, Dr. Nathan Chomilo. I want to thank you, Dr. Teresa Ramos. You are amazing people, leaders, parents, partners, fellows. And my bold move is to just keep thinking it's going to be possible to build the world that we have yet to experience. And with conversations in community, in commitment, in grace, we will get there together. So thank you all so much for joining us. Thank you, Teresa.
Thank you for
Nate.
having us and bringing us together.
Yes, thank you, Ann.
Amen. Radical
Stay safe,
collaboration.
That's right.